San Antonio woman Otty Sanchez, who told authorities the devil made her mutilate and dismember her newborn baby, pleaded not guilty by reason of insanity in a plea deal that will send her to a state mental institution instead of trial and possible prison time. Defense attorneys entered a plea on behalf of 33-year-old Otty. It was accepted shortly afterwards as part of a plea deal with prosecutors. Scott Sanchez was 3 weeks old when authorities, receiving a panic 911 call from the baby's aunt, arrived to find his mutilated body and Sanchez wailing the devil made her do it. On the call, Sanchez can be heard screaming, "I didn't mean to do it, he told me to," while the sister pleads for an ambulance.
My sister, she's her child. Hello? Tell me what's going on. Don't talk to the other people. Talk to me. My sister, she's hurt her child. Seriously, you hurt her child. How did she do that? What's going on with the child? The baby is dead. What do you say? The baby is dead.
This was probably one of the most horrific cases we've seen involving a child, said the district attorney. Otty was charged with taking his life and found competent to stand trial. But the attorney said that after 3 examinations by different doctors, concluded that she was legally insane. The court had no choice but to accept the plea. The attorney said she will be committed until court determined she is not a danger to herself or others, saying she was scared by what Otty did, but also by the fact that she sought therapy before the crime and didn't get the treatment she needed. A lot of people do well when they're on medication, but when they stop taking it, they're at risk again. Otty sought mental help at times before her son was born and even spent a few hours in the emergency room after the birth because she heard voices less than a week before the attack. Defense attorney said she was prescribed an antidepressant after giving birth, but only took it a day before she attacked her son. Medications don't work for a few weeks. About 1 in 500 mothers suffer from postpartum psychosis. These women can suffer from dangerous delusions and a desire to hurt their children. Unlike postpartum depression, which affects up to 1 in 5 mothers, suburban Houston mother Andrea Yates, who drowned her 5 children in a bathtub in 2001, and Dina Scholar, who cut off her child's hands in 2004, both suffered from psychosis. Their lawyers said justice has come a long way since Yates was convicted in 2002 and faced a possible death sentence. Yates was sentenced to life in prison before her case was overturned on appeal, then was found not guilty by reason of insanity in 2006 and sent to a state hospital. I think as a society we need to recognize this gendered mental disorder is real. New mothers sometimes experience severe depression. Some mothers become psychotic. Mental evaluations filed by attorneys in the case paint a picture of a woman who was beaten, harassed, and diagnosed with various forms of psychosis and was in and out of the hospital for half a decade before she hurt her son. In interviews, Sanchez described using substances for the first time in 2006, 3 years before the birth of her son, saying that's when she first started hearing voices. Her addiction led her to Austin, where she tried to find her ex-boyfriend, Victor. She was taken to Austin, where doctors diagnosed her with psychosis. However, she was given a prescription and released. 2 years later, she was seen at the San Antonio Health Service Center. Court records show she was paranoid, somewhat delusional, depressed, and psychotic. With hallucinations, her medication was changed. While taking the medication, the voices disappeared, but she could not afford the cost of the medication. She was forced to stop taking it. Shortly after stopping the medication, that's when Otty became pregnant. She was referred for depression counseling during her pregnancy, but refused to take medication. After the birth of Scott, Otty sank further into depression, and the voices began to return. Soon before the attack, she was once again admitted to the hospital. The doctor reported Otty had auditory and visual hallucinations and delusions. Otty indicated she needed hospital treatment, but she was discharged to the care of her sister. In the days leading up to the crime, Otty said she was paranoid because she feared people spying on her and would take her baby away. The paranoia deepened as the voices began to worsen. Sanchez said that for several days, voices told her that the devil was in her son. She avoided looking him in the eyes for fear of seeing the devil. Otty described the circumstances of the crime and what the voices said to a doctor before the crime happened. The voices told her that her mother assassinated John F. Kennedy and Marilyn Monroe, and that the KKK was angry with her mother for this, saying, "The voices told me to hurt Scott. He will be the end of the world," explaining her decision. "The voices told me to eat his insides. I was a whore because I committed adultery. There was a demon in my stomach. Demons would come out of her stomach if she ate Scott. It had to be done before 5 in the morning. Scott would evolve and not be possessed anymore." Otty says that eating the baby made her throw up, but the voices told her to eat again. After being arrested for taking Scott's life, she was taken to the hospital where she kept hearing voices telling her that she had received a heart transplant and that she was going to be injured. After evaluations, the doctor concluded that Otty suffered from mental illness, writing, "It is my medical opinion that Otty Sanchez was incapable of telling the difference between reality and her delusions." The other doctor commenting, "It is my opinion based on reasonable medical evidence that Miss Sanchez has a severe mental illness, paranoid schizophrenia, at the time of the alleged crime." The senior police officers at the scene were so shocked that they could hardly speak. When officers arrived at the home in North San Antonio at 5 a.m. on July 26, they found a bedroom covered in blood, a baby less than a month old decapitated and mutilated, and his mother screaming that the devil made her do it. Otty left the child's father after a fight and lived with her mother and cousins. Around 4:30 in the morning, while the rest of the family was sleeping, she attacked her young son with a large kitchen knife. Police described the crime as one of the most horrific they have ever seen. Some of them needed counseling later. It was hard to imagine that anyone in their right mind could do that, and it turned out that she wasn't. Otty suffered from postpartum psychosis, a rare but severe form of postpartum depression in which paranoid hallucinations drive new mothers to violence. There had been multiple warning signs. Otty had been in a mental health crisis for at least a week before the crime, but when she reached out for help, she was pushed away. Days before she took the life of her son on July 20th, she saw a doctor that encouraged her to keep Scott in her care despite knowing immediately that she was not well. Obviously delusional, paranoid thoughts that other women were trying to breastfeed her baby. The doctor wrote she heard voices telling her that others wanted to take her baby away. Also seeing other faces on Scott's face, she was obviously not fit to care for a child. The doctor immediately suspected that Sanchez was suffering from postpartum psychosis, knowing that she had a history of depression and developed paranoid schizophrenia a year ago. New mothers with severe mental illnesses are much more likely to experience postpartum psychosis. Most alarmingly, she had stopped taking her antipsychotic medication. The doctor decided she needed an immediate psychiatric evaluation. This doctor was at a gynecology center and transferred her to a hospital with a psychiatric center that could better handle the situation. He tried to convey the message with the EMS that picked her up that she likely had postpartum psychosis and newborn Scott was in danger. However, the message about the seriousness of Otty's condition was not communicated. At the hospital, she was diagnosed with visual hallucinations and hearing voices, but nowhere in her hospital records does the more serious diagnosis of postpartum psychosis appear. Though she was admitted to the hospital for a mental health crisis for 3 hours after she arrived at the hospital, nurses did nothing more than perform physicals and lab work on her and determined that her body was mostly healthy. Otty was examined by a member of the hospital's psychiatric team, not a psychiatrist, but a trained counselor. The evaluation lasted 44 minutes, and transcripts of the session show the severity of Sanchez's condition. According to the hospital, she experienced voices and hallucination and sees babies' faces change. She applied for admission to the hospital's psychiatric inpatient unit. The counselor wrote, "Patient states she needs to be admitted due to voices." Hospital treatment has worked for Sanchez before during a similar crisis in 2008. She was hospitalized for more than 2 weeks until her mental health condition stabilized. Now she asked for similar treatment. She was a good candidate for institutional care. A diagnosed schizophrenic who was in the hospital a year earlier, who had just given birth, who stopped taking medication, heard voices and hallucinations, saw her child's face change to another face. Her lawyer commented, "You'd think they would at least talk to her doctor and ask about her history, but they didn't do anything like that. Instead, the hospital used a different standard for its psychiatric ward. It mostly comes down to the simple question, did she feel she wanted to harm herself or someone else?" Apparently, new mothers rarely answer this question honestly. Many never admit to having infanticidal thoughts because, in addition to the social stigma of being told they could harm their child, they fear that if they answer honestly, the government will take the child away from them. Otty was already having paranoid hallucinations of strangers wanting her son, so it's hard to know exactly what was in her mind at the time. But whatever she thought, she told a hospital counselor that she had no desire to take her life, someone else's life, and did not have hallucinations. According to hospital records, the hospital was asked about their admission standards to the psychiatric unit. Answering, a qualified mental health professional performs a psych assessment focusing on 3 things: whether the patient has the desire to take their life, someone else's life, or has experienced a deterioration such that if we let them out of the hospital, they would be a danger to themselves or someone else. The qualified mental health professional then gives assessment recommendation to the ER, and the doctor makes his own assessment on whether patient needs to be admitted. Doctor's recommendation always stands. Doctor bears liability for decision. She was sent home with the name of the clinic so she could contact the outpatient clinic. Although she was not given an address or contact information, she never made an appointment for outpatient treatment. This is not uncommon. People in a mental health crisis are unable to take care of themselves. Their mental state is too weak and agitated for basic outpatient treatment. They cannot be trusted to take their medication or show up for appointments. They often need to be hospitalized for a short time until their mind stabilizes to the point where they can function independently. He was also given an information sheet, a document that lists common descriptions of hallucinations and delusions and schizophrenia. The document urged her to call your doctor or go to an emergency room immediately if your symptoms worsen, essentially telling a sick person, "You're sick and take care of yourself." 6 days later, she was back into the ER. This time she was escorted by police. Her face was still smeared with blood from consuming her son's body parts. Texas may have the most complex public mental health system in the nation. The state ranks 49th in mental health spending per capita. Only New Mexico is worse. As a result of this poor approach, hundreds of thousands of Texans with serious mental health problems are left to fend for themselves. For many people, the public system as it stands is the only option. Private services are often prohibitively expensive, and most insurance plans offer minimal coverage for mental health care. A few days in the private care facility usually wears out the mental health benefits offered by even the most decadent insurance policies. However, the lucky ones receive services in the Texas public system. Texas has about a dozen state hospitals, which are almost always close to capacity and difficult to access due to limited bed space. A network of 39 community mental hospital facilities provides counseling, medication, and other outpatient services. However, due to extreme lack of funds, community centers can only provide assistance to a small percentage of those in need. State officials estimate that the centers can afford to treat a third of blind Texans with serious mental health problems, leaving at least 400 largely untreated. The irony of Otty Sanchez's case is that all of the places involved in the mental health crisis in Texas, San Antonio may be best equipped to provide treatment. The clinic, like many other community mental health centers in Texas, is woefully underfunded by the state. But the center has formed alliances with police, judges, and other health care providers in San Antonio to create some of the most innovative treatment programs in the country. Among other innovations, the center has worked with San Antonio police on a program that trains officers to detect and calmly subdue people with severe mental illnesses without violence or arrest. The healthcare center, which treated Otty for 3 months in 2008, also created programs to keep nonviolent offenders with substance or mental health problems out of prisons. In 2005, the center helped open a 10-bed inpatient mental health crisis center where people can stay for 23 hours if they have nowhere else to go. The emergency center accepts referrals for hospitals with their psychiatric wards are full, meaning the hospital could have sent Otty to the 24-hour emergency center if they didn't have room for her. Together, these programs house nearly 1,000 people a month, keeping them out of the county jail. This saves taxpayer money, and providing people with the treatment instead of incarceration greatly reduces the chance that they will break the law again. But despite these advantages, lack of funding reduces the results of these programs. They only have so many people they can take care of, as they don't have enough money to meet their needs. Public funding for mental health services has not kept pace with demand. One of the main reasons is the way Texas distributes money to the state's community centers. Funding is not based on the population of the clinic's service area. Rural areas with declining populations receive far more money per capita than Houston, San Antonio, and Dallas. Cities with exploding populations and rising states of mental illness. Many attempts have been made to change the way money is allocated. Most advocates understand that mental health funding levels should be based on population, but the legislature has resisted that change. It was largely blocked by rural lawmakers, whose sparsely populated areas would lose money. If these matters were taken more seriously, it is likely something like this would have never happened, because Otty would have gotten the treatment she needed. Hearing voices or seeing random hallucinations is not unusual in the Sanchez family. Her mother, aunt, and cousin all suffered from similar mental health issues. She was an only child and never knew her father. She grew up in a tight-knit household with 7 other relatives. The family moved frequently and lived in at least 3 states during Otty's childhood. They returned to San Antonio from California when Otty started high school. Otty's mother and 2 of her cousins declined interview requests. Although Sanchez was later diagnosed with paranoid schizophrenia, her relatives had no idea she was mentally ill until a year before the incident. In part, this can be explained by the illness of other relatives, but her symptoms were also easy to ignore. Apparently, they intervened only in her life when Otty got to the point of hospitalization. According to a recent psychiatric evaluation of her at the county jail, she has been hearing voices since she was 5 years old. The voices are often good voices telling her everything is going to be okay, but she also hears evil voices, one in particular called Lucy that told her to do bad things like eat my own hands. She was able to live with these voices and mild paranoia for years. Her mental illness has worsened until getting to this point. Her demeanor became erratic. She had trouble keeping a job, moving from one low-paying job to another. In late May 2008, she went to Austin with a friend. During this trip, she walked into a CVS and shopped for 7 hours. She said she was shopping for a trip to China. That would never happen. Police arrived and took her to the hospital, where she remained for 16 days. That was the first time her family learned of the severity of her mental illness. After her mental health condition stabilized, she was released. During the summer of 2008, Otty, who was uninsured at the time, received free outpatient care at a San Antonio clinic, including regular counseling and antipsychotic medication. According to her health reports, she soon recovered. But at the beginning of September 2008, everything changed. Health services, with their budget tighter than ever, could no longer afford her care. She could either pay or receive state compensation. Believing she would never be able to afford treatment, she didn't show up to her next appointment. Clinical staff did not have the time or resources to track her down. They moved on to the next patient on the waiting list. A month later, the center classified her file as closed. Soon after this, she became pregnant. She got through the pregnancy without incident. Her OBGYN prescribed her antipsychotic medication. She didn't take any during pregnancy, but she said the medication made her too tired. She stopped taking it less than a month after Scott's birth. This was 9 days before she committed the crime. Her doctor was about to put her on another medication, but before that happened, she and Scott's father got into a fight on July 20th. She left him and fell into a crisis. Emotional stress often worsens postpartum depression. This is when she went to the hospital for help. Though she was only given the information packet, this was the last chance to prevent murder. 12 days before the attack, Otty visited her ex and his mother. She was staying with relatives and wanted to take the baby's diaper bag and her medicine. At this point, she had gone over a week unmedicated. His mother noticed that she seemed erratic and paranoid. At one point, she refused to let Scott's grandmother hold him because she was afraid she would try to steal her son and breastfeed him. Her ex said his mother told her she needed help, causing her suddenly to get up and run out of the house. His mother called police, saying she ran off with the child and was unstable schizophrenic. In the weeks after the attack, prosecutors faced a different decision. Should Otty Sanchez be charged or sent to a state hospital for treatment? Despite evidence that she was insane at the time of the crime, some in San Antonio publicly called for the death penalty. Among them was her ex and the victim's father, who told a San Antonio television reporter, "I think she should be punished to the fullest extent of the law. She took the life of my son. She should burn in hell." In prison, she received counseling and medication that she had such limited access to the outside. Interesting how in the United States, prisoners often have more unrestricted access to health care, while millions of Americans struggle to afford life-saving treatment. At this point, her medical condition stabilized. As a result, she was declared competent to be tried. As investigators determined she understood the legal process and the charges against her. Her lawyer planned for her to plead not guilty by reason of insanity. Prosecutors planned to seek the death penalty for her. Otty Sanchez was found not guilty by reason of insanity. She is committed to a hospital in Texas where the court receives an annual evaluation of her mental capacity, though it is said realistically she will never be released, saying that something like this is unlikely to be cured. Play the 911 call.